On the outskirts of Philly, over the bridge in Cherry Hill, New Jersey, 56-year-old Larry Lane recalls the day migraines became a part of his day-to-day existence.
I was in work and I felt a zigzag pain in my head, and subsequently after that I started getting lightheaded. And the following day I started having headaches for about 10 to 15 minutes. They kept on getting repetitively worse as time went on, and then they started getting longer in duration until I started experiencing them every day.
Living with daily head pain can certainly interfere with a person's ability to function well.
My daily life, my headaches were so bad my wife had to take off a half of a day to take care of me because I was unable to really take care of myself. And I was bedridden, or I would lay on the couch for the majority of the day.
How did your children feel about their father having headaches all the time?
I started getting them every single day, and my children were very upset.
Migraine interferes with patient lives, not only when they're having attacks, but between attacks. When they're having attacks, they can't take care of their children, they can't go to work, they can't have meals. Between attacks, they worry, and they may not make events. They're afraid to go to the theater, afraid to go to the movies, they're afraid to go out or even have a job.
I went from a person who went to work every single day, worked 40 to 60 hours per week, tried never to miss a day of work, and then I went on disability and I couldn't even work a day. It totally affected my life. It stopped me from doing a lot of things on an everyday basis. It put my life on hold.
Migraine impacts industry to the tune of $13 to $17 billion a year due to absenteeism, lost productivity, and medical expenses. Migraineurs lose 157 million workdays each year. And there's something called presenteeism, where someone is at their job, present, but not performing up to their peak level.
Patients will live with headache pain for years before seeking medical attention. But there are some warning signs patients should heed when deciding whether to visit a healthcare provider about their migraines.
If your headaches or migraine or disabling interfere with your life, your work, despite taking simple over-the-counter medications, or if you're taking over-the-counter medications more than twice a week, you should seek medical care.
Well, when we think about migraine treatment, I think the first tool is education. So before I even think about medications, I think it's really important to talk to patients about, how they eat, how they sleep, how much caffeine do they do, because there are a lot of things that can help with the education piece, even without medications, to have patients have less frequent and less severe headaches. And I think that's really important and something we don't think about as much.
But drug therapies are often prescribed to stop migraine attacks once they have started. Acute therapies, such as over-the-counter medicines or prescription medications like triptans and ergotamine products, are taken once the headache has begun. Acute therapies can be effective. However, if they are taken too often, they can have serious consequences.
If one uses those drugs more than 2 or 3 days per week, week after week, month after month, let me say it again, using those drugs more than 2 or 3 times a week after week, month after month, those drugs will actually change brain cells, and make you more vulnerable to headaches, and you will have more headaches. And so the more medicines of those types you take, the more pain you will have.
The second approach to migraine treatment includes preventive medications, which are taken on a daily basis whether or not the headache is present. Patients are prescribed a preventive therapy when they meet the following criteria. 1. Frequency of headache is at least twice a month and causes disability at least 3 days in a month. 2. Migraines significantly interfere with daily routines. 3. Patients rely on acute medications more than twice a week. And 4. Acute medications are contraindicated, not tolerated, or ineffective.
We have several different types of drugs that we use for prevention. We have beta blockers, we have anticonvulsants, we use antidepressants, among many. Now, none of these drugs prevent entirely. In other words, they're not 100% effective. If a person has a 30 or 40, 50% reduction in frequency from preventative agents, we call that success.
In addition to drug therapies, patients are also advised to use non-drug therapies.
In terms of more natural products that people use, people have used magnesium supplementation, coenzyme Q10, people have used riboflavin, and while the evidence is less solid with these medications, or there isn't as much data there, certainly in some patients they work, and it's reasonable to use them.
Okay, one more sensor. Turn your head a little bit. Good.
Biofeedback is another therapy that has had success in some migraine patients.
It's a way of controlling your own body, whether how tight your muscles are or how much blood flow goes to your arm. And how do you do that? By monitoring your temperature. The act of learning to control your body makes it easy to control your headaches, and most patients who've had biofeedback get improvement in their migraines.
I think for any migrainer there's a journey, and you have to find what fits you as a person and also what fits your headache pattern.
Doctors treated Larry with a combination of medications aimed at both preventing his headaches and treating the pain when he does get a headache.
It's a long, slow process. I've had headaches for about 8 years now, and I have them every day, and they're not as severe as they used to be, but I still have them on an ongoing basis.
Things are fine.
Yeah, things are better.
Want it morning time?
For Renee Charlton, living with chronic daily head pain made caring for her family almost impossible. So she and her husband made the decision to relocate and move in with Renee's parents.
They were so bad that at one point I couldn't even get out of the bed. That if I sat up even a little bit of an angle, my head felt like it was going to explode. At that point, I just told my husband, we're going to have to leave Georgia and go back to where my parents are because my mom doesn't work. She can help me full time.
Now Renee is being treated at a comprehensive headache clinic. Under the care of a group of headache specialists, Renee is finally getting the treatment she's needed for so long.
And being at the headache clinic made me feel like I was somewhere that understood me. And even though they couldn't say, this is exactly what's wrong with you, this is exactly what you need to take, I felt like somebody was saying, we're going to figure this out.
Still ahead, we'll see what the future holds in terms of new treatments for migraine headache sufferers. And we'll check back in with Lori, Larry, and Renee.